Hi there.
Hi.
Nice to meet you.
Nice to meet you.
My name is Dr. Sumita. I'm the chiropractor here.
Okay.
So today we are going to be doing a first assessment for you for your spine and chiropractic health.
Mm-hmm.
So I have your intake form here. You've filled it out.
Mm-hmm.
So I'm just going to ask you a few questions. Okay? All right. And how are you feeling today, by the way?
Yes, good. Perfect.
Good? Okay, great. So I have here that you have some, at night you have some snoring, right? That's one of the problems that you've been having.
Mm-hmm.
Okay. And you have high blood pressure.
Yeah.
Yeah, so we will check that. And anything else here? Is there anything else you want to add to any health conditions you have at the moment? No?
No.
Okay. Have you been in any car accidents recently?
No.
The past 5 years?
No.
Okay. Any surgeries? Have you had any surgeries before?
No.
Okay. What medications are you taking at the moment?
Just the high pressure.
Just this one here?
Yeah.
Okay. All right. And do you have any complaints at all? Any low back pain, spine pain, neck pain, anything like that? Okay. Okay. And what is the level of stress in your life? Mild, moderate, severe? Moderate. Okay. What's your main source of stress?
Is work stress.
Work stress. Okay. And do you smoke?
No.
No. All right. Do you exercise sometimes regularly?
Regularly.
How often do you exercise?
Every day. Yes.
Every day. Very good. How do you exercise?
Yeah, just doing some sports and exercise in the morning.
Mm-hmm. What kinds of exercise? Like, can you explain it a little bit more? Like, do you do push-ups, sit-ups, squats, that kind of thing? Like body weight? Okay.
Yeah, body.
Body weight resistance. Okay, I want to ask you a bit more about your sleep. Do you sleep on your stomach, on your side, or on your back?
It's sometimes it's side, sometimes it's back.
Side and your back. Do you sleep on your right side or your left side?
You always change right and the left.
Right and left, okay. Do you use a special pillow? Like a orthopedic pillow, chiropractic pillow, anything like that?
No, I just use normal one.
Just normal pillow? Okay. And how is your diet?
Is yeah, I get about 4 kilos less.
You like reduce 4 kilograms of
Yeah.
weight? Oh, amazing. Since when?
Is about around this 2 months.
So for the past 2 months, you've lost about 4 kilograms. That's
Yeah.
amazing. Congratulations.
Thank you.
And would you say it's because your diet is also healthier, like
Yeah.
your food?
Yeah.
So would you say your diet is poor, good, or excellent?
Good.
Good?
Yeah.
Okay. What kinds of food do you eat? Breakfast, lunch, and dinner?
Yeah, it's like it's have egg, vegetable, and also it's like coffee,
Mm-hmm.
and also it's like gluten-free bread.
Okay, so you eat gluten-free at home?
Yeah.
Very good. Okay. Do you eat any fast food like McDonald's
No.
or KFC? No?
No.
That's very good. Okay. All right, so you said that you don't have any pain, any kind of problems with your spine or your back.
No.
Okay, that's good. Right. Your family health history. Does anyone else in your family get chiropractic care?
Yeah.
Who in your family gets chiropractic care?
Is my wife,
Mm-hmm.
and also is my daughter.
Okay. Since you don't have any problems, I'm guessing that you're here just to maintain the health of your spine, make sure everything's okay, especially now that you're getting older. We want to make sure that everything's functioning normally. So we will do that. And you filled out this part. Perfect. Okay. And do you have any questions for me before we get started?
That's it. Yeah.
Okay, good. So I'm just going to start by taking your vitals. Okay, please open up your mouth. I'm just going to put this under your tongue. Please hold it. Just going to take your heart rate. Pulse is 64 beats per minute, and respiration rate is 16 breaths per minute. Can I check your temperature? Okay, 36.25. Very healthy. 6.25 degrees Celsius. Okay. Let's check your blood pressure today.
Okay.
Okay. Please raise your hand and pump your fist 10 times. Okay, your blood pressure is 135 over 75. Just remove that. Okay, so now that we have your vitals done, I'm going to be checking your posture. So I'm going to start by checking in the front here. So I'm just going to grab this here. And posture is very, very important when it comes to the health of your spine and your body. So I'm checking the top of your shoulders. They look fairly symmetrical, which is very good. Okay, can you please turn around like this? Yeah. Okay, so I am checking the top of your scapula. Okay, and over here, and just seeing if it's symmetrical. Okay, so here the right side is slightly higher than the left side by about a centimeter. Okay. And then I'm going to look at your PSIS. So can I just have you lift your shirt slightly in the back, just like this? Okay, good. Just hold it up. Perfect. And I'm just checking your PSIS and seeing if that is symmetrical, which it looks like it is. Perfect. You can lower this now. And I'm also going to check your hips and see if it is symmetrical. And just going to check your greater trochanter. Okay, and I think that the right side is just a little bit lower. Okay. Now I want you to turn around and face the front here. Now I'm going to look at your side profile. So what we're trying to see is that your tragus of the ear should match up in line with the center of your shoulder. So right here at the acromioclavicular joint, and then which should line up with your greater trochanter, and then your medial malleolus. So just looking from the side, checking. This looks pretty good. Okay. Can you put your hands like this so I can take a look? Okay, so a little bit in line, but I do feel that perhaps the hips are slightly behind. And then I'm just going to check the knees as well. The knees are slightly behind the hips, and the medial malleolus is slightly behind as well. So I think overall you're having sort of like you're bringing your your abdomen too forward. So I think you need to bring it back slightly. Yeah. And we'll work on this as we go. I also want to check the curves of your spine. So if you can turn around again, This way? Yep.
Mm.
I'm just gonna check. Okay. So I'm just looking to see if there's a good lordosis here. And there does seem to be, but your head is slightly forward. And then just put your hand down. I'm looking at the thoracic kyphosis, which is there, and then the lordosis is here as well. Okay. Okay. Very good. I'm going to have you actually change into this gown so we can take a closer look at your spine. Okay?
Yeah.
Okay. Just gonna grab a pair of gloves for this part. All right. So I'm going to start by checking the spinous processes of each spine. So we're going to start at the top, at each vertebrae, I mean. And let me know if you feel any pain, okay?
Okay.
So we're coming to C7, T1, T2, T3. Seven. Okay. Can you just lean forward a little bit, curve your back forward just a little bit? Good, thank you. It just helps to be able to palpate each one. Okay. Any pain?
No.
Okay, good. Any pain down here?
No.
Okay. All right, so you can come back up. Just gonna check for any scars, areas of normal hair growth. Okay. Right. Let me just check the facet joints on either side of the cervical vertebrae. Okay. Any pain there? Okay. Next, I'm going to check the paravertebral muscles because they can tell us a lot about. Just check this. Tell us a lot about any muscle tightness, any pulling on the vertebrae, because they're all connected to all kinds of vertebrae. And when these muscles are tight, they can reduce the mobility and function of the vertebrae. And we know that it's really important for these vertebrae to be mobile in order for us to be physically healthy, but also neurologically healthy, and to reduce risk of injury. So any pain when I go like this? Okay, very good. So no pain or tenderness along the spinal processes, paraspinal muscles, and okay, let me check the SI joint. So I'm checking the sacroiliac joint right here. Any pain here?
No.
Okay. And any pain on this side?
No.
Okay, very good. Let me also check other parts of your neck. checking the upper trapezius muscles, the lower trapezius muscles, and then also the SCM in the front, whether it's tight at all, and then also the rhomboid muscles and the lower traps. Okay, it's all very nice and loose, which is so good. Okay, then latimus dorsi and the thoracolumbar fascia. Okay, perfect. All right. Now you can, I'll have you turn actually, yeah, I'll have you turn around. Just gonna quickly tie that. So we're gonna check your neck active range of motion. So I want you to do the same thing as I do, okay? Good, and then other side, other side. Okay, so you have some restriction in your range of motion there. I want you to go forward, flex forward. Okay, so it's about 30 degrees. And then go extension backwards. Extension's not bad, it's just, okay. And I want you to rotate like this. Okay, that's pretty good. Other side. A little bit of restriction here. Okay. So on the left, there's some restriction. And the lateral flexion, and extension is good. And then the forward flexion has some issues. Okay. Okay. Now I want you to stand up and turn around. Okay. So I want you to lean forward, like go forward as far as you can. Okay, and just stay there. And I'm just checking. Can you go forward even more? Okay. Okay, come back. Perfect. I was checking to see if there were any parts, like for instance, any parts of the thorax that one side was higher than the other. That can suggest scoliosis, which I don't see. And then your flexion is really good. Can you come back slightly? I want to see if you can touch your toes. How far can you go? Okay, pretty close. That's good. And then I want you to flex this way. So as far as you can. Okay, very good. Other side. As far as you can. Okay, a little bit restricted there. Don't bring your heel up. And then I want you to rotate this way. Sorry, no. So keep your hips here, and then rotate. Oh, only a little bit. No, not like that. Okay, no. So keep your hips straight, the same, like this. Yeah. Just move the upper part of your body, like this. Like this? Yeah, like that. Just a little bit. Okay, good. Other way. Okay, so just about 10 degrees. Okay. Very good. What else? Now I want you to come back. I'm supporting you, so just come back as much as you can. Very good. Good job. Okay. While we're here, I'm just going to check CVA tenderness. I usually do this because, like, for people who are a little bit older or young 20-year-old women, they might have some kidney problems. So I always check this just in case. So I'm just finding the costovertebral angle, and then any pain. Okay. And here again, find the costovertebral angle. Any pain? No. Okay, good. You can sit down. Yeah, so you can just relax as much as you can. Yeah. trying to find your patella. Okay. Okay. Hyporeflexia on that side. Check on the side. A little bit more on that side. Okay, I'm also going to check your ankle reflex. Okay. Good. Now we're going to do a few orthopedic tests. So we'll start off with the straight leg raise. This will tell us about whether you have any sciatica issues. So just relax. Let me know if you feel any pain. I'm just going to dorsiflex, internally rotate. Any pain? Okay. Very good. Then we'll do the same thing on the other side. Just relax, relax. Let me raise you up. Dorsiflex, internally rotate. Any pain? Okay, very good. All right. I'm going to do a sensory test called the Babinski reflex. So you don't have to do anything. I'm just checking. Very good. Very good. Okay. That's just checking the upper motor neurons to see that they're functional. And next, I'm going to be doing some sensory testing along your legs. So we're going to be checking pain and light touch sensation. So I want you to tell me if you feel pain or light touch. Yeah, pain or light touch.
Pain.
Good.
Touch.
Very good. Good. Good.
Pain.
Good.
Pain. Light touch.
Good.
Light touch. Pain.
Okay.
Light touch. Pain. Light touch.
Okay.
Pain. Pain.
Okay, very good. So I have this dermatome chart. I'm just going to put it right here on the side so we can refer to it as we go. I'm just going to use this brush like this, and I want you to let me know if it feels the same on both sides or different, okay? So we're going to start around here, all three. Okay, same or different?
Yeah.
Same, good. Next is just going along the entire dermatome. Okay, same or different? Different? Is it different?
Feeling is same.
Feeling
but
is the same?
Yeah.
Okay, then what's different?
Is one is straight, and the one is like.
Oh, then let me do that one again.
Yeah.
Okay, so this one is L4. And then this one is L4. Okay?
Just same.
Okay. So I have to do a better job. And then we have L5. Just bring the light closer here so we can see everything better. Okay. So this one is L5.
Same.
Okay, very good. And then we have S4, just right on the outside.
Same.
All right, perfect. So let me check some of your myotomes as well while we're here. So I want you to just resist your muscles against my hands. So go ahead and resist. So bring your legs up into my hands. Okay, here. Let's do it this way. Okay, push your legs into my hands. Push your legs into my hands like this. Yeah. Okay. Push your legs into my hands. Very good. Push your legs into my hands. Very good. Okay. Push your feet into my hands. Your feet. So like just the foot. Very good. Now the thumbs of your feet, the big toes. Very good. Okay. You can bring it back down. And then just one more test. I'm going to do this. And then just bring it around like this. And let me know if you feel any pain.
Little bit.
Just a little. Is it pain or discomfort?
It's not so pain, it's like uncomfortable.
Okay. Other side. So this one's, we're testing the SI joint. How about this side?
Yes, same as the right side.
Okay. All right. Okay, so we finished all our tests for today. I'm going to go over the results, and we might have to order some x-rays. I'm not sure yet. We'll see, depending on your risk factors and everything. And then in the next appointment, I'll let you know about your results, and we can start our first chiropractic adjustment. Okay?
Okay.
All right. Thank you very much.
Okay, thank you.
Take care.
Yes.
Bye.